I am Dr. Stephanie, your double board certified critical care physician who works with physicians that are struggling with their jobs, burnt out with their careers, or who just want some career advice. Through my books, webinars, coaching, and speaking, I help physicians discover alternative jobs and careers in medicine so that they can practice medicine on their own terms. And happy Tuesday night. This is day 2 of our Facebook Live lecture series celebrating National Physicians Week. So throughout the course of this week, we are going to have nightly discussions talking about things that impact physicians. But before we get started, I have a couple of favors to ask of you guys. If you're watching me live, please put in the comments where you're watching me from. If you're watching me on replay, press replay. If you like my comments, press the like button. If you love my comments, press the love button. Please feel free. Hey, Dr. Tamisha. Hey, Miss Tamisha, how are you? Please feel free to share my broadcast. So like I said, tonight we're going to celebrate National Physicians Week. And our topic today is America's love-hate relationship with physicians. Now, last night we talked about the economic impact that physicians have on their communities and on their hospitals. But tonight we're going to talk about this love-hate relationship that I'm sure a lot of us physicians are feeling nowadays. And unfortunately, it seems that sometimes it's more of a hate-hate relationship that the American public has with us. But we're going to talk about the love-hate relationship that America has with her physicians. Now, let's kind of back up a little bit and talk about National Physicians Week. National Physicians Week was started by Dr. Kim Jackson, I think 2 years ago, through her organization, Physicians Working Together. And why do we need a National Physicians Week? Well, the easy answer is every other specialty, every other healthcare provider or healthcare personnel gets a whole week, and we doctors only used to just get a day. So that's like the short answer. But the long answer is the reason why we need a National Physicians Week is so that we physicians can not only just celebrate ourselves, but we can kind of educate the public about who we are, what we do, and the sacrifices that we make to be physicians. So National Physicians Week is for physicians, for medical doctors that have MDs or DOs and practice medicine in the United States of America. Current doctors, retired doctors, all physicians. This is what National Physicians Week is for. So like I said, last night we talked about the economic impact of physicians, and I'm sure some of you were quite surprised to know that the average physician supports 17 jobs. The average physician generates over $1 million in revenue for their associated hospital, and physicians are responsible for contributing millions of dollars in state and local taxes to their local economy. So we have quite the economic impact. But tonight we're going to talk about America's love-hate relationship with physicians. Now, in 2016, there was a physician, and there was a survey that asked people to list their most respected professions. And in 2016, physicians did top that list. So it seems that the public does respect us and respect what we have to offer and the care that we give patients and the sacrifices that we make as physicians. However, it seems that with social media, and everybody has access. Hey, Natasha, thank you. Proud of your dedication. Thank you so much. It does seem that with social media that there's such, and everybody has access to the internet and everybody has an opinion. And it seems like that there's so many negative things put out by physicians. And then, when you have the constraints of corporate medicine and all of the administrative tasks and the burdensome tasks, it seems like physicians aren't getting any more love. So that's why, this is a very important topic to me and to my other physician colleagues. So let's see here. So we're going to spend a couple of minutes talking about the reasons why I think there's this love-hate relationship with physicians. And I think one of the most important things that contributes to this imbalance in how we are perceived is unrealistic expectations by patients and the public. Now, on one hand, physicians trained so hard, went through college and then medical school and residency and fellowships. And we had to jump through so many hoops and so many hurdles just to get to the point that we were able to practice medicine. We went into a tremendous amount of debt. Medicine is both an art and a science. And like I said, it took us years and years and years and years of study and training and supervision to learn the science of medicine. And it takes us our entire lifetime to learn the art of medicine. But I do think that, sometimes patients and the general public put too much confidence in the actual science of medicine. Hi, Dr. Anila. Hi, Dr. Dawn. Thank you for joining me. We put a little too much confidence in the science of medicine, too much confidence in medications, too much confidence in imaging studies and treatment modalities. And we physicians know the limitations of these things. And when, we always try to do our best to explain, the risk and the benefits, but I still think that sometimes people may have these unrealistic expectations. And we know as physicians that a lot of times everything can be done right, but there's still going to be a bad outcome. And I think that this whole unrealistic expectations, the fact that expectations aren't met, kind of contributes to this somewhat dissatisfaction with physicians. Dr. Dupart says, absolutely, we do have to trust our own judgment. And that goes back to this whole thing about, medicine being not just a science, but medicine has to be an art, and it's a science because we can read the guidelines, we can read the studies that show, you have to treat X amount of people in order to get the benefit, and the number needed to treat is this, and this is the risk of complications. We know this, so we can help, our patients go through this information. But then again, at the same time, we also know the art of medicine as well too, because that's why training matters. That's why we go through so much training and experience matters. But still, at the same time, everything can be done right, and you still have bad outcomes. And I know Dr. Dupart, with her being an obstetrician, has to deal with managing the expectations of her patients every single day. Another reason I think that Americans have this love-hate relationship with their doctors is because there is the perception that we don't have enough time and there's too little time being spent. And I do think that that is a very real issue, and we physicians have issues with that as well too. There's increasing financial pressures put on us by our employers, by the hospitals, by the insurance companies. We have to hit our productivity targets. Dr. Anila Kaur says unrealistic or otherwise, exactly, unrealistic expectations. But we have to meet some productivity targets. And so as a result, in order to keep the lights on and to meet the expenses that are involved in the overhead of running a practice, of being employed in a practice, that we are forced to see more and more patients over a shorter amount of time. And while most physicians would love to have an hour to spend with each new patient and 30 to 40 minutes to spend on each follow-up patient, and we would love to be able to talk to every patient on the phone, whoever calls us, during office hours, we just don't have the time. And the thing is that because physicians are seen as the face of medicine, a lot of patients don't realize what's going on behind the scenes, and that they're frustrated because they feel like they've been rushed through and their needs haven't been heard. The physician is frustrated because, our patient panel is full. We've got all these other things to tend to. And so that leaves both the physicians and the patients being unsatisfied. And that is something that we are trying to work to change. The other thing that I think contributes to this, love-hate relationship that people have with their doctors is the belief that physicians are replaceable. I know that my physician friends can tell you that Dr. Google is the bane of their existence, because now with, the internet being so readily available on your laptop, on your hard top, on your phone, on your watches, and then with social media, and people put anything and everything on social media. People now crowdsource their symptoms, and they have everybody from across the world giving them advice. So then you go to your doctor's office with this list of not only your complaints and list of your symptoms. You've researched and consulted Dr. Google, and so now you want all these medications done, you want all these tests ordered, and you want all of these imaging studies ordered, and they may not be necessary. But then when your real physician, the real doctor who actually went to medical school and did residency and plus or minus a fellowship, and who has hundreds of thousands of hours of experience, when they try to tell you that what Dr. Google prescribes is not necessarily the best thing, you may not be happy about it. See, physicians, our job is to first do no harm. So we're not going to do what you necessarily want us to do just because you want us to do it. So have y'all seen this mug that's going around that I want, and I know a lot of my other physician friends want, and it says, "Don't confuse your Google search with my medical degree." So yeah, that's kind of how we feel. But in addition to, and don't get us wrong, social media and the internet and are a great source of good information, but there's a lot of bad stuff going out there as well too. So when you take this information to your physicians, please be receptive to what your physicians have to say in terms of why this may or may not apply to you in your situation. And then the other thing, about physicians seeming to be easily replaceable, not only by, social media and internet and all this online information, is the fact that there are a lot of non-doctors who are springing up, non-physician providers who are seeing patients and not necessarily telling you that they're not physicians. And so these people are being hired because they're cheaper. They're being hired to replace physicians. And, the proliferation of these non-physician providers in practices in which they're not closely supervised can be associated with increased patient costs and increased patient harm. So, there's this whole, undercurrent that's going around that is making the public believe that physicians, MDs and DOs who went through the process are easily replaceable, and that's just not the case. So I would just caution everybody just to realize that there is no substitute for the training that we go through. Like their old saying goes, that you can't take the elevator to the top. You got to climb the stairs. And each and every physician who has practiced medicine in the United States of America, who has gotten an MD or DO, who is licensed to practice medicine, has taken the stairs to the top, and we climb them every single day, and there is no substitute for that, because training counts. Now, the other big misperception that the public has that is circulating everywhere is the belief that physicians make too much money. So whenever people start talking about doctors, there's always this, "Oh, well, you guys make too much money. You're just in it for the money." And so physicians are often driven as money hungry and money driven. But what people don't know, and the stuff that is not talked about, is the fact that most physicians are hundreds of thousands of dollars in debt from undergraduate school and medical school, and that debt takes decades to clear. So once you get out of undergraduate school, you're $50,000, $60,000 in debt from your or maybe $100,000 in debt from your BS degree. Then you have to go to medical school, and that's another $200,000. So you're $300,000 in debt, and you don't start making good money until you are in your 30s. So all of this debt that you've accumulated since the fact that since you were 18 years old and you took out your first student loan has been generating interest. So y'all do the math and see how long it takes physicians to pay this money off. And so many physicians are going into specialties that aren't high dollar generating specialties. You have family practice physicians, you have pediatricians who are not making great amount of money. You have people who are going to work in underserved areas. They're not going to work in these areas because they're trying to make all this good money. They're going to work in these areas because they truly love their patients and they really want to make a difference. So you're having somebody who is 33 years old, just starting their professional career, and they're looking at $350,000 worth of debt that's going to take them another 15 years to clear off. So, people don't talk about that. You only see, the physician that's 75 years old who's been practicing for 40 years. You might see him driving his Mercedes and maybe playing on the golf, but trust and believe he paid his dues in order to get there. And another thing is, a lot of physicians are often, Dr. Kaur says she's happy that her debt is under $200,000 now. And this is a board certified OBGYN. And I can guarantee you she didn't make $200,000 a lot of the times in her career. So yeah, how much longer it's going to take her to pay that debt off? And then a lot of times when this discourse comes about, why is healthcare so expensive? Everybody wants to point the finger at the physician. Everybody wants to talk about physician salaries. But let's talk about this. On average, each doctor generates about $1 million in revenue annually for their affiliated hospital. Now go back and look at the Facebook Live that I did last night that really breaks those numbers down. And you would be surprised to know that family practice doctors are only second to orthopedic surgeons in terms of the amount of money that they generate annually for the hospitals that they are affiliated with. So your average family practice physician generates about $2 million in annual revenue for their affiliated hospital. And I guarantee you, family practice doctors are not making $2 million a year. But people don't talk about the money that physicians generate for their practices, money that physicians generate for their hospitals. Did you guys know that on average, each physician supports an average of 17 jobs? Okay, so there's 17 people that are able to work because we're working. We create jobs, okay? Do you all know that for every one physician, there are 10 administrators? So the main people that are telling us how to do our jobs are not generating revenue, but they're trying to tell us how we need to do our jobs so that we can generate more revenue to pay for their salaries. So, but nobody's talking about the administrative bloat that is causing healthcare to be so expensive. Everybody wants to talk about us physicians as if we're the bad guys. Nobody talks about the salaries of the hospital CEOs, and I'm not begrudging anybody of the money that they make, but I just feel like when we're going to talk about why healthcare is so expensive, that we need to talk about everybody's role in this and stop just blaming the doctors. Nobody talks about how the insurance company CEOs make salaries that are well into the 7 figures. Nobody's talking about that, but everybody wants to say, oh, it's the doctors who make too much money. And I'm just saying that it's not just us. Everybody plays a role, and everybody needs to be looked at equally to see the role that they play in terms of why healthcare is so expensive, because it's not just the doctors who make all the money, quote unquote. And this is another thing a reason why I think that America has this love-hate relationship with physicians. Years ago, patients used to be patients. Okay, and they went to their doctors because they were sick or trying to get better or wanted to stay better because it was healthcare. Now patients are customers, and medicine has transitioned from being a profession to being a business. So now you have customers, but I'm going to tell you that the customer is not always right, and the patient is not always right. And because now patients are being seen as customers, customer satisfaction is a really big deal with hospitals and healthcare systems. And it is the bane of a lot of our existences because Patient satisfaction scores are now being tied to hospital reimbursements, being tied to physician salaries. But we all know that just because you're satisfied with your care doesn't mean you got good care. For those of you who are parents, I'm sure your children like you a lot better when you let them eat candy as opposed to when you make them eat their vegetables. And I'm sure there are times when your kids will even tell you that they don't like you, that they like grandma better because grandma lets them eat ice cream and Doritos, and you insist that your child has a well-balanced meal. So we know that satisfied patients don't necessarily aren't necessarily on the receiving end of good care. Satisfaction does not equate with good care. But what happens is sometimes, despite our best efforts, bad things do happen and bad outcomes occur. Sometimes that's just the course of things, but that doesn't mean that people did anything wrong. Patients often are dissatisfied for many things. We all know that we have a huge narcotic problem in this country. We have a huge issue with opioid abuse in this country. And oftentimes people will get upset when they go into the emergency department and the emergency room doctor is like, I'm not giving you Dilaudid. You're not getting fentanyl and you're not getting morphine. Well, that same patient can go and fill out a report that they're dissatisfied because they did not get the medicine that they thought they would get. You guys would be amazed at the things that hospitals do to ensure higher patient satisfaction scores. A lot of times patients get upset with their primary care doctors or their urgent care doctors because they think they need a particular test, but we physicians know that that test isn't indicated. So what happens? Patient negative fills out the survey in such a way to reflect the fact that they're not satisfied. Even things such as the hospital food. Y'all, it is the bane of my existence as a critical care physician. Once I get my patient over their critical illness and, we start advancing their diet and I'm like, okay, let's put my diabetic patient that just had a heart attack, let's put them on a diabetic cardiac diet. And then I go see what they're eating and they have pancakes and syrup and orange juice on their tray. And I asked the nutritionist, I'm like, what is really going on here? And I cannot tell you in how many hospitals and how many nutritionists I've talked to, they said, we understand that, but with the patients don't like the food that they've gotten to eat, they rate the hospital low. So there's all sorts of things that happen under this whole umbrella of patient satisfaction, which is really not fair because it really does not enhance the quality of care that people get. So this whole focus on a patient customer satisfaction and treating the patient as a customer and not as a patient who is in need of actual health services, to me, it sets up unrealistic expectations. A lot of times you have people who go into hospitals who actually think that this hospital is some kind of boutique hotel resort. They're treating the nurses like their own personal wait staff. And it can't happen like that. Hospitals don't work like that. We're in the business of getting people well. And so I think it's this imbalance of expectations when people expect one thing and then the true reality of being hospitalized or the true reality of the healthcare experience doesn't mesh. You have a lot of people who are disappointed both on the patient end, on the receiving end, and on the care delivery end as well. Another reason why I think that there's this love-hate relationship with physicians is I think that, the physician-patient relationship has eroded over the past several years. Care is so fragmented, and I'm just as frustrated with the fragmentation of care in the healthcare system in America as most people are. Based on what kind of insurance you have, you may have to change your primary care physician. Your hospitals may change due to the contract negotiations that your healthcare plan has with the providers of care in your particular market. So you might have to change your PCP. Whereas you used to be able to go to this hospital system down the street, now that hospital no longer takes your insurance, so you're going to have to go to the hospital across town. Nowadays, you have this division in hospital, in medicine. You have outpatient physicians, you have inpatient physicians. So a lot of times when you're hospitalized, you may not see your primary care physician. They may not have privileges at the hospital in which you are admitted, or they may have given up seeing in their hospitalized patients. I'm a critical care doctor, so I'm one of these hospital-based physicians. So, I understand this quote unquote fragmentation of care, and depending on the communications between the hospital-based physicians and your outpatient physician, your primary care physician, there can be a whole lot of things that are kind of missed in the process. We physicians recognize that this is a problem, and we are actively working on ways that we can improve and streamline communications between groups of physicians both in and out of the hospital. But I do think that's one of the reasons why people do get so frustrated, is because who is my doctor? Who am I seeing? The medical teams are so huge. Even when you go to your physician's office, there's a chance that you may not see your actual physician. You may see one of their physician extenders. When you're in the hospital, you maybe receive care from various teams, and there's various doctors and other team members that are rotating in and out based on their schedule. So there's a fragmentation in a delivery of care, and also kind of an erosion in the physician-patient relationship. And also there are other things that come to play that kind of serve as a barrier to improve physician-patient relationships. Physicians are bombarded with, it seems like, never-ending regulatory things that we have to do. We've got to check these boxes. We've got to jump through these hoops. We've got to increase time constraints. Electronic health records can be a blessing, but they can also be a curse, because we've got to get those notes signed. We've got to get the messages dealt with. We've got to get everything signed off in that EHR system. And so there's so many things that are vying for your physician's time when they are with you. And I also think that that is one of the things that causes a barrier and an erosion between the physician-patient relationship. So, and the thing is, we physicians realize that we are the face of medicine. So often times the general public wants to blame the doctors for everything that's wrong with medicine. And we understand that and we get that, but we just want you guys to know that we're just as frustrated as you are, and we are trying to do things as much as we can to kind of change the system. But there's so much more that goes on behind the scenes. So I think that these are some of the reasons why, on the one hand, people it respect us for the work that we do, but then on the other hand, they're frustrated with how broken the system is in the United States of America. And fortunately or unfortunately, physicians are the face of the healthcare system in America. So that's why we kind of get it on both sides. So what are we physicians to do? First of all, I would encourage all of my physician colleagues to take the time this week, with this being National Physicians Week, to tell your story. Tell everybody, hey, this is National Physicians Week. Tell everybody who you are and what you do. I've got some great people on here. Dr. Angelique Sales is a pediatrician, and she does locums just like I do, and she does locums in rural communities. So she is that pediatrician that's going to the town that it takes 2 connecting flights to get to make sure that that baby who's in respiratory distress gets the care that they need. Dr. Anila Cord is an obstetrician gynecologist who cares for mommies and babies. Dr. Dupart is an obstetrician gynecologist who cares for pregnant women, who bring life into this world. And so I would encourage that all of my physicians tell people who you are and what you do, and stand up and be proud. Tell people, this is where I went to undergraduate school. This is where I went to medical school. This is where I did my residency. This is where I did my fellowship. This is how many years in training I've had, because people need to know who we are and that we physicians care and that our training matters. The other thing physicians have to do, we have to continue to advocate for our patients and to push back against policies and trends that jeopardize patient safety. And I know sometimes when we do that, we may be putting ourselves in jeopardy. I know that I've gotten in trouble for some things for saying, hey, this is dangerous. Some of the admins didn't like that. I've suffered the consequences, but we want the patients to know and the public to know that we physicians are advocating for you. We're advocating for you. So I encourage all of my physician colleagues to get active in organizations that advocate for physicians and patients, because it's all about patient safety. And then also, physicians, we are needing to advocate for ourselves in order to protect the integrity of our profession and to protect, the integrity of medical practice in the United States of America. There's threats at all sides. A lot of non-physician providers are pushing for independent practice. And this is not necessarily in the best interest of patients. So we need to continue to advocate for our profession, to advocate for patient safety. We need to make sure we advocate for fair compensation, because a lot of physicians are being overworked and underpaid, despite the fact that we contribute generously to the economy and the tax bases of our communities, that we generate millions of dollars of revenue for the hospitals for whom we are affiliated with. We need to advocate for humane schedules and good working conditions, because at the end of the day, advocating for these things just makes things better for the patients, because it's all about patients. So for my physicians, I want you guys to be encouraged. I want you to stand up, celebrate yourselves this week, and let everybody know who you are and what you do. So in honor of National Physicians Week, I have a special offer. As you guys know, I am Dr. Freeman. I am the locums guru. So in honor of this week, I am offering a free locums webinar entitled Locums 101, Everything That You Need to Know in Order to Get Started. This webinar will be on April 16th. It is a free webinar, and I would encourage everybody who is interested in learning more about being a locum tenens doctor and how to get started to register for this free webinar now. Space is limited, so go to www.locums101.com. Thank you so much for joining me, and meet me here tomorrow at the same time for our continued celebration for National Physicians Week. This is Dr. Stephanie. Thank you, and bye-bye.